YouTube always takes forever to go live. But so are we all good? All right, okay. So it's very exciting to see you again. Does everybody remember who this man is? Yes, they're saying yes, yes, yes. And look, you can verify, hearts already coming in, nice green and peachy hearts, a few purple and pink ones, but they are coming in especially for you. Yes, Dr. Bob, it is. Now, okay, well, tell us, everybody, your name.
Hi, everybody. My name is Dr. Bob Zajac. I'm a board-certified pediatrician. And if it's okay, I'd like to tell you a little bit about myself. I have 8 kids. I have 15 years of training in what I'm about to talk to you about. My background is in child development, a 4-year degree. I was getting my PhD in special education 4 years before I surprised my wife with my desire to become a medical doctor. That added 7 more years. And then just for fun, I have a 2-year degree in master's in business administration, so 17 years. And happy to share some of that experience with you in my personal journey as it relates to vaccines and injuries of children.
You are seriously qualified.
I've been reading about this a lot. As you know, medical doctors don't have a lot of training in vaccines. We don't have a lot of training in anything in detail unless you become a specialist. I've been reading about vaccines since 2009, about an hour a day. I started reading about vaccines when I saw my patients getting hurt, and that was really hard for me. I didn't want to believe it. In 2003, you all, literally everyone would have hated me. Biggest jerk of a jerk doctor you ever would have met in 2003, biggest ego of any doctor I think that was ever created. And when I walked into my community, I told everybody how blessed you are that I'm here now. And in the next 2 years, I noticed that there was a separation in my patient population. There are patients that were seeing the local chiropractor that were healthier than my other patients, and they were doing some other things for their health other than just using medication for whatever condition they might have. They also had a lower vaccine uptake, and they were healthy, and that was really hard for me to recognize. My partially or unvaccinated patients, and none of us liked them, quite honestly, back then. They were going against their medical doctor's advice, and with the ego that I had, that was really hard to swallow. It took me a couple of years to start reading about vaccines, and the moment I started reading research about vaccines, changed my life forever. I didn't know anything beyond the vaccine information statements, where we find out that vaccines are perfectly safe. You'll become immortal if you vaccinate, and if you don't, all the babies in the world will die. And that's what the CDC wants us to believe, and I understand why they say what they say. When I started reading vaccine inserts, I was blown away at what had been studied or not studied, at the numbers of kids that were studied. A study of 2,000 kids, and then we start vaccinating 4 to 8 to 12 million kids to see what happens. And it changed my life when I saw vaccines having a higher injury rate than what we expected. We had a brand new vaccine that would come out, and we'd start vaccinating kids, and instead of a 1 in a million reaction, we were seeing kids, 1 in 100 being hospitalized, or having to create special rules that if you received a vaccine, you had to lay on the table for 20 minutes because you might pass out as you were leaving our clinic. Really hard for me. I am embarrassed to admit that I was still a vaccine bully, that in my practice we needed certain vaccine rates, and you couldn't question my authority, but then I started to make personal decisions for my own children where we wouldn't give my kids any new vaccine that had just been released. A silly rule at the time for what I know now, but I was never going to test vaccines on my kids again. And in 2007 or 8, I forget, I experienced my first regression to autism with one of my patients. Now, you've all heard the same story, that they were born with autism and the doctor just didn't know that they had autism, and it's really hard to pick. No, that's not true. My background's in child development. I was working with kids with special needs. I had a perfectly normal child in my practice until they received his 12-month vaccines. When I walked into the room at a 17-month visit, I literally saw a child I'd never met before. I thought I walked into the wrong room. I stepped out to look to make sure I was in the right room because I did not recognize this child. He had regressed into autism, one of the saddest cases I've ever seen. And hard to admit that I struggled with recognizing that really happened to my patient. I still know the child today. I'm working with him. He's doing well, but it opened up my eyes. That's when I started reading about vaccines. A few years later, we had a patient die after his shots. They called it a SIDS death at 2 in the afternoon, a few hours after his vaccines. I remember the discussion, and I don't want to violate any confidentiality, so I'm going to be very careful with the words that I use. the coroner asked the ER doctor, do you think this was related to the vaccines that the child had earlier today? And the doctor said, well, no, it wouldn't have been the vaccines, implying, of course, that vaccines are perfectly safe, so it was marked as a SIDS death, and everybody moved on. That family has peace. It was SIDS. It was unavoidable. It was just a random bad event. But that's when I started reading about vaccines. And it led to a transition in who I am today. I also want to humble myself before you. I read about an hour a day about vaccines, and I work with moms in my practice that read 10 hours a day. They know more than I do, and that's amazing. And to all the medical doctors who are watching this, I'm sure they know more than you do. There are a handful of doctors in our country that know as much as these moms do, because once your child was injured by vaccines, you'll never stop researching it. I have all the stories in the world to share about patients in my practice, children who've been injured by vaccines and stopped vaccinating and working to recover. Many healthy kids who have never had a vaccine, and some kids who are partially vaccinated. And doing this for 15 years now, I'll share with you that the vaccinated kids are the sickest, the partially vaccinated kids are not as sick, and the unvaccinated kids are the healthiest. Now, of course, bad things happen to kids. There are kids who are unvaccinated that still die. There are kids who are unvaccinated still get leukemia and asthma and allergies and eczema, regress to autism, have developmental delays, everything in between. But the disease rates and the illness rates are highest in the vaccinated children. I am a faith-based person. I want to share that with you, that I'm really stressed about end times for me when I have to answer to what I'm doing with kids. Did I do my job by vaccinating or supporting unvaccinated kids? I'm going to have to answer to that, because for what I've read, it's very hard to have peace with vaccinating children on the regular schedule. But let me share with you how I have peace, if that's okay with you.
Please do.
When children are vaccinated in our practice, they need a doctor who will recognize vaccine injury. And they're going to be vaccinated anyway, so I will watch them and I will watch for the injury, and then we'll have that discussion. And if children are unvaccinated, they need a doctor who's been reading about vaccine-influenced diseases. I don't say preventable, I say influenced. They need a doctor who knows what this looks like and knows how to treat the illness itself. And everywhere in between, in my heart, families need informed consent. I'm part of a group called Physicians for Informed Consent. We believe that it's very important that families understand that for any medical procedure, there's a risk or there's a benefit. And with that risk or the benefit, we need to have a discussion. And you do not have informed consent when you read the vaccine information statement, and you certainly don't have informed consent once you get the vaccines and your nurse gives you the statement after the fact. You have informed consent when you have an open, honest discussion with somebody who's actually trained to have the discussion with you. Then the family gets to make the decision. And after we chat, or after they chat with any one of our partners across the country, they choose to vaccinate, we're going to love them, we're going to pray for them, we're going to hope that it goes okay. They choose not to vaccinate, we're going to love them, we're going to pray for them, we're going to hope that that goes okay. But at the end of the day, they had true informed consent. I would love nothing more to have safe vaccines. I think that would be amazing if we had safe vaccines, or even if we had accountability for vaccine injuries. There are three things that I need before I'm going to jump on the pro-vaccine bandwagon. Number one, we need to have accountability to the vaccine injury for the vaccine industry for vaccine injuries, right? You need to be able to sue somebody if they hurt your kid. As the only industry in our country where you have no option for litigation if somebody's hurt, because correlation doesn't mean causation, you gotta be kidding me, right? Like a kid falls over and they get a bloody nose. Yeah, they fell, they hit their nose, and their nose is bleeding. That was not correlation. We saw what happened, they got hurt. Vaccine injuries happen, whether it's immediately or years afterwards. We need to be able to hold people accountable. That's gonna drive safety. Now that's not my medical training or my pediatrics training, that's my master's in business training. You have to hold markets accountable for injury. That's how you have safety. That's why we have safe products in our country as best we can, because you actually get to hold them accountable and sue them when they're not protecting our children. The second thing is we need to study vaccinated versus unvaccinated kids. We have plenty of people who would volunteer for that study that are vaccinated, plenty of people who are unvaccinated. We need to study that. We need to have placebo-controlled studies so we can see what happens if I inject you with nothing compared to vaccines, and have that up front, not after the fact where we're trying to figure out what happened to our children. Once we have those things, including long-term outcome studies, right, because some of the stuff happens years, not moments afterwards. Once we have those, I promise you I'll be in the forefront of vaccinating children in our country. Once we have full informed consent for the providers as well. Until that point, we have to have a discussion. If that makes me a bad doctor, call me a bad doctor. We need to save and support our children and our parents' rights to decide what they're going to inject. I'm sorry, did you have any questions?
Oh, I'm just mesmerized that you're getting so much love. Okay. just to remind people, they recognize, some of them are like, I recognize him. And now tell them why they recognize you. What happened?
A year ago, I showed up to our Minnesota Capitol to support my friends and professionals and parents who were there to testify about the risks of vaccines and to support parent choice for vaccines. I do not support mandated vaccines. Parents have to have a choice. And as I was sitting in the back there supporting and praying for my friends and families, I felt compelled to get up and give my own testimony. And boy, did I just go nonstop for 30, 40 minutes, just speaking the truth and love to everybody who would listen to me. And some people love that about me, some people hated that about me, but I feel like what I said was defensible. I feel like it's evidence-based, and I'm proud of what I said, and I'm proud of what I'm saying today, even though 95% of you is going to love this and 5% are going to hate it. Just leave my wife and kids out of it.
Oh, absolutely. I can't see any haters. So one of the famous lines that you came out with was the amount of money that you do not make because you don't choose money over life.
Correct.
And it was quoted around that it was 700,000.
Correct.
Where did that figure come from? Is that for your whole practice, or was that just for you as a pediatrician?
At the time, that was for me as a pediatrician with my patient volumes. When we calculated the profit margin, you know that there's a profit for vaccines, correct? There's a profit margin for each vaccine. And so as a business owner, again, business degree, pediatricians don't have business degrees, I calculated the profit of each vaccine that I give and the profit of each vaccine that families chose not to receive on that day. $700,000 is my lost profit because I don't make everybody vaccinate in our clinic. That number has gone up with the number of providers that we have. That number has dramatically increased because we cannot get a favorable contract with our insurance companies because we don't have a high enough vaccine rate. We're now up to about $1.7 million that our clinic does not make every year, lost profit, because we aren't playing by the vaccine rules. And I love my wife with my heart, my soul. She frequently asks me, how important is this vaccine issue to you? Because I think she would really like that $1.7 million. We barely pay our bills each week or each month in the clinic. It's that important, and it is what it is. So we're going to keep going as long as we can survive as a clinic. Each month it's hit or miss, and those are the rules that we have to play by, but the kids are more important than the money.
Wow. I mean, literally, wow. Why are there not more pediatricians coming out? Surely there are other pediatricians that even at least have faith and realize they have to do the right thing. Surely there's so many that the level of bullying that we record as we go around the world it's horrific.
Well,
from pediatricians.
I believe that pediatricians don't necessarily understand all the issues involved, and I say that without judgment, right? If you don't know, it's hard to be held accountable. For sure, pediatricians who don't own their own clinics don't understand the financial ramifications of a lower vaccine rate. Physicians, including a provider at one of my previous practices, realize that if you have to talk about vaccines, you lose money. If you give the vaccines and it didn't take you any time to talk about it, you optimize your profit. For you personally as a provider, but also for the organization. If you spend 10 or 15 minutes talking about a vaccine and a family chooses not to vaccinate after they have informed consent, you lose 15 minutes of your productivity for the day, and you certainly don't make the profit for the vaccine. So when physicians haven't read about vaccines, I understand it, right? We're busy, and we hope that we can just put some of these things at ease, right? If you have asthma, you need an inhaler. If you have eczema, you need a steroid. Let's just use the protocol. Let's use the algorithm. Let's provide care that we learned, and I don't judge that at all. Vaccines are different because we're making a recommendation suggesting that they're perfectly safe, and they're not, and we're hurting kids, but we won't know it or admit it unless we read. My hope is that physicians, under the pressure of parents, will stop and actually read about it. They'll read some great books that are out there. They'll actually go to peer-reviewed research and study the vaccine ingredients, as opposed to what the pharmaceutical representative hands you when they're selling you the vaccine.
Wow, so I hate to say this, it sounds kind of mean, but it is true, I feel. That pediatricians, and please, it's just from what I've heard going around, they are pharma sales reps. Because you're prescribing inhalers, antibiotics, drugs. When does any pediatrician ever say, you know what, You need to go home, you need to have some vitamin C, you need to drink plenty of fluid, just like the doctors used to do in my day. That was what they did. And all we hear from the parents is, oh, give them Tylenol, and take a course of antibiotics while you're at it, and here's an antidepressant for you, Mum. So we're hearing.
It's what we learn in medical school, and we're medical doctors, and we're infallible. When we received our medical degree, we inherited the wealth of the knowledge of the universe, and at that moment, we knew more than anybody. And it's very scary to think that that isn't true. Now, not every doctor feels that way, but I would hazard to guess many do in my interactions, in my experiences. And so if we step back and we realize that not everything needs a medicine or a surgery, that maybe our bodies are designed pretty perfectly and we can step back and let our bodies heal, or we can look at other options, such as time, or hugs and kisses, or maybe a warm bath, and move beyond that. I think that many physicians would be surprised that they don't need the medicine. And on a business side, you can make almost as much money, which is pretty cool too.
What you mean out of
if you don't prescribe a medicine, or if
really?
you make a little bit more money if you prescribe a medicine, but ultimately it's about providing care. And so we can just step back and humble ourselves and serve patients in our country.
So let me get this straight. You are supersonic qualified doctor. You also have business qualifications as well. So you're just pretty all-round brain box. You thought vaccines were great because that's what you were taught. You then woke up and realized it's not, so you did the right thing, which means you lose out on lots of money. You have 8 children, so someone who doesn't have maybe the faith or whatever it is that does it for you would have thought, I need to pay for these 8 children. I've got 3 and I can barely feed them. So I can't imagine 8. So I'm seriously, thank you, because you have sacrificed so much and your family has sacrificed so much. But I think the big guy upstairs is going to be really proud of you.
Thank you.
Ultimately, if every doctor was like you, we would not have the problem that we live in today.
Right.
So on behalf of all the parents, you are getting so much love, it's unreal. And these people are going to share and share and share. And when no doubt that you get the usual online trolls, just give us a call and our peeps will have your back.
Thank you.
Because that's what we do.
Well, thank you for what you're doing in our country to save our children.
We'll save the babies. All right, loads of love. You've got to watch this back. You will not believe it. Look, on all channels. So we're going to, Dr. Bob, they love you. Okay, you need to know that. All right, we're going to come off and we'll be back on with a new story.